What is sleep restriction therapy for CBT sleep? Have you ever found yourself tossing and turning, wishing for a good night's sleep? If so, you might be curious about sleep restriction therapy. This technique is part of cognitive behavioral therapy for insomnia, often referred to as CBT-I. It aims to improve sleep quality by limiting the time spent in bed. The main idea behind sleep restriction therapy is to reduce the time you lie awake in bed. This can often lead to frustration and poor sleep. By limiting your time in bed, you can increase your body's natural drive to sleep, which is known as the homeostatic sleep drive. So, how does it work? Initially, you will restrict your time in bed to match the actual amount of sleep you are currently getting. This means if you are only sleeping 4 or 5 hours, you would limit your time in bed to about 5 hours. This restriction increases sleep pressure, making it easier for you to fall asleep and stay asleep. As the weeks go by and your sleep efficiency improves, the time allowed in bed is gradually increased. The goal is to achieve about 85% of your time in bed spent actually sleeping. This process helps consolidate your sleep and reduces those annoying nighttime awakenings. Sleep restriction therapy is typically delivered over several weeks as part of a structured NUL program. It often includes other components, such as stimulus control therapy. This helps retrain your brain to associate your bed with sleep rather than wakefulness. Cognitive therapy is also included to address any unhelpful thoughts you might have about sleep. Key elements of sleep restriction therapy include setting a consistent sleep schedule. This means going to bed and waking up at the same time every day. This helps regulate your body's internal clock. Limiting your time in bed increases your sleep drive, which reduces the time it takes to fall asleep and decreases those frustrating nighttime awakenings. As your sleep becomes more efficient, your time in bed is gradually increased. Support from a therapist is essential to help you adhere to this plan. They will provide guidance and education about why this therapy works. From the perspective of cognitive behavioral therapy, sleep restriction therapy addresses the behaviors that maintain insomnia. It breaks the cycle of spending too much time awake in bed, which can worsen sleep difficulties. It also challenges negative beliefs about sleep by showing you that a structured schedule can lead to better sleep. This therapy is effective in improving how quickly you fall asleep, increasing your total sleep time, and enhancing the percentage of time you spend asleep while in bed. However, it may not be suitable for everyone, especially those with certain health conditions, such as bipolar disorder. It should always be conducted under professional guidance within a NUL framework. In summary, sleep restriction therapy is a key behavioral component of cognitive behavioral therapy for sleep. It uses controlled limitation of time in bed to strengthen your sleep drive, consolidate sleep, and improve overall sleep quality. By changing maladaptive sleep habits, it can help you achieve the restful nights you deserve.